Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Eventually, what I'll do then is I'll get a little stand.
Hi. Good morning.
Good morning. Good morning. It isn't. It's a cold morning. Is it a good morning?
It's a beautiful morning, nice and cool, and the sunrise in Florida, and the rain has stopped. But here we have the cold front that had come all the way down to South Florida, and for the first time since I've been here, we have snowed in northern part of Florida. So, it's a good time to talk about. We're always talking about prevention in medicine. And it's a good time to talk about prevention for the winter.
Before you do that, I want to tell everybody, I believe you are on Facebook Live, Anita Finley, or Boomer Times Facebook page. So why don't you go and do that? So let's just see what happens. Oh, someone's already. Let's see. Stu Perlin is watching.
Oh, cool.
Yeah, see who's watching.
Don't get me nervous now.
Okay. See who's watching. We don't want to see who's watching. Go ahead.
So anyway, with the winter now, Anita, you know that we talk about getting immunized, getting your flu shot, see if you have had your pneumonia injection, have you had your shingle injection. Well, with this winter coming all the way to South Florida, it's sort of a wake-up call to South Floridians, because South Floridians say, okay, winter is here, but we don't really go through winter. When we do go through winter. We don't get cold weather like in the northern part of the country or Canada. We don't get the cold weather, but we do get winter, and we get a lot of the snowbirds that come from the north during the winter time, and they bring with them their bacteria and their viral infection and what have you, and they mingle with us. They interact. They go to a restaurant. They get up. We sit down. So you go to the doctor. You sit on a chair. They sit on that chair. So there is a lot of interaction. They open a door knob at the restaurant or at the doctor's office or
you never really
at a
think
coffee
about
shop.
that.
You don't think about when every time you open that door, it's contaminated. And a lot of times you see people, they go to the bathroom, they use the elbow to open the door to get out of the bathroom because they already wash their hand and they don't want to contaminate themselves again. So we take a lot of precaution, but doesn't, because we don't get this cold weather all the time. This is, I've been here for 20 years. I never had, weather.
No, this is pretty cold.
This is cold. It was in the high 30s.
Yeah, it was in the 40s.
Yeah.
It's very common to wake up in the morning. I asked Siri, what's the
Tallahassee
temperature?
was, you saw the snow falling down in Tallahassee. So it was really cold, and the rest of and then you're going to see more snowbird coming this year because it's so horrible up there, up in the north. So we need to take in consideration or use this as a wake-up call to say we should get immunized. And I'm very proud of IGI, our office, because when the patient will come, we got a lot of new patients, I tell you, during Christmas and the week between Christmas and New Year, and just before Christmas and before and right after New Year, because a lot of doctors' offices, as of yesterday, were still closed.
Is that right? Terrible.
And I see the pharmaceutical rep coming to me and say, Dr. Mencia, I have nobody. I have the rep that brought us lunch yesterday.
I have to interrupt you. I have another person that's watching says Alex Gheorghu. Good morning, Doc.
Good morning,
I don't
Alex.
know who he is.
Good morning, Alex.
Keep going.
I'm not able to watch the screen, so whatever Anita tell me. So
Yeah,
for
right.
the rest of those people watching, I'm just, having the show with Anita and Ina Leskovi here. So, dobre utra, Inuchka.
Dobre utra.
But go ahead and carry on with this. So it's not too late for people to have flu shots, what you're saying, right?
It's still early in the game. Remember that this is just the beginning of winter. Winter had just begun. And when you see the winter start like this, it's the same thing when we are during hurricane season. The moment we hit hurricane season and you see storm coming your way, get prepared because you might get a lot more right after that one. So, as Floridian, we know how to get prepared quick, and this is the time to get prepared. The other thing is, we living in Florida, most people have their own cars, their own form of transportation, be a car, be a motorcycle, bicycle, whatever your form of transportation is. When you get this cold, check your tires.
Really?
With the cold weather, your tire pressure will tend to go down.
I didn't know that.
Yes. Tire pressure tend to go down, and check your tires. And if you see that it doesn't all follow them. It could be the two on the side, or the two in the front, the two in the back, or three of the four tire, whatever it is. Check your tires. And if your car is one of those modern cars, you can even, there's a button you press that they say your vehicle, and then it shows you the four tires, and it tells you what pressure you have and what pressure you should be. So, for those of us that have flown plane, we always do our pre-flight before getting on a plane. And that's why you don't see that many accidents on plane, because you do your pre-flight each and every time. So I remember going from here with my friend to, let's say, the Keys. And we would do a pre-flight, go to the Keys, and from the Key coming back, do another pre-flight to come back to Fort Lauderdale. So when you get in your car, do your pre-flight or pre-drive, and check your car. Make sure, do you have enough gas? Are the tires okay?
Well, let me interrupt you to say that if you don't check and you wind up having to be in your car and now it's not working, and you talk about getting sick.
Exactly.
We don't want you to get sick, right?
And then if the weather drop again, remember that for us Floridian, we are not the one that have the tendency of having winter coat, but you can wear multiple layers. When you go to work, and I tell my staff, put on multiple layers, and I see them. I don't have to instruct them. You just watch them. You see as the temperatures start warming up, they start getting layer off and layer off. Don't put
we have
multiple...
someone else watching now. They just... I shouldn't interrupt you. I won't do that.
Don't put on multiple layers, and don't put on multiple layers and then take them off as soon as you get to work. Allow your body to warm. Like I always tell my patients, listen to your body. When I give them something like anti-inflammatory, listen to your body. If your body's asking for it, you take it. If your body don't ask for it, don't take it. So when you have those multiple layers on, wait for your body to feel that it's getting warm and take one off, and wait a little bit, take the next one off, and take off the layers one at a time. And you'll see that you will have a tendency to allow your body temperature to adjust. And it's very difficult to get sick when you when you take all those precautions.
Okay, I have
a lot of vitamin C, vitamin E. This is the time for good supplements. And I always say, supplements only if you don't eat well, then you should take supplement. Well, this is the time when the winter is here for us to take a lot of vitamin E and vitamin C to keep your immune system active, and they become so important for helping you fight viral infection.
So tell me about something. I've been a big proponent of zinc. So I buy the zinc lozenges because when someone starts to get a little bit of a scratchy throat, I always tell them to start with zinc. Am I wrong?
No, zinc is good. The ginger, the ginger tea, hot ginger tea, excellent for the immune system and to fight, infections. Drink hot stuff when you're on the way out. So you don't want to drink and go in the cold. You want to drink and allow the body temperature to adjust, because remember, this have to go down. It have to be absorbed into your system. So drink and then allow the adjustment of the temperature. Bundle up and then go out on the if you have to be exposed.
That's something I didn't know that.
The scarf becomes very important. So when you go out, wrap the scarf around your neck. Remember the thyroid is the master of metabolism. So keep your thyroid nice and warm. So bundle up, put the thyroid, cover your thyroid and cover your throat with the scarf. Wear socks, long socks, so that they warm you up. And for those of you that have supporting stocking, that because either you have swollen leg, it's a perfect time to wear the supporting stocking to help you, because it become another layer to keep you warm.
Okay, but I have another question. I don't think you should go out with wet hair. A lot of people,
I don't think so either.
And it's funny. My husband used to say, "Oh, it won't make a difference." But my mother said, "Don't go out with wet hair."
And I love the old folks tales. I'm telling you. My grandmother used to say the same thing, and they used to fight with. My grandfather died about 109, right. And he has a full head of hair.
Right.
He was all white, but full head of hair. I'm already getting bored. I
didn't take after him. You got everything. But wait, the other story is oatmeal. You have to have some hot cereal.
Hot cereal, hot chocolate, hot ginger. Drink, keep yourself warm. Keep yourself warm. Once you get home, don't undress yourself just like when you went to work. Don't just take all the layer off. Allow the temperature to adjust a little bit. If you have fireplaces at home, remember the fireplaces, you have an outlet on top of the fireplace. If the outlet is open, the cold air is going to come in.
Yes, it is.
Not only it's going to keep you cold, you're going to waste a lot of money. And people don't think about it. In Florida, we always keep the air conditioning on, and now we are using the heater. But when the fireplace, unless you're going to use it, make sure those outlets are closed, because it's going to save you money, because you are saving energy. And it's going to keep your house warm. So once you get home, then, walk around, get your pajamas, do the thing you're going to do, put your food out, and then start going layer by layer slowly, because your temperature at home is going to be different than the temperature in your car, and so on. And try not to, when you get in the car, try not to use the heater a lot. It's not that cold to put on the heater, because when you step outside, you're going to have that change in temperature when you heat your car, let's say 70 degrees. When you step outside of your car to get into your office or your house, remember it's 40s or low 50 or high 30s. So that swinging in temperature, the body doesn't like that.
Okay, so I was going to ask you that, but how about taking a hot bath? There's something about taking a hot bath when you feel cold.
Okay, that's a good question. If you're going to take a hot bath, which is great, bring the towel close to the shower or the robe that you're going to wear, and put it close to you, so that when you take a hot bath, you're heating up your surface temperature on your body to around 90, high 80s. If you put the water really, because, you're going to be able to turn the water even hotter. So, you can put that temperature really, really high. And when you come out of that shower, that's when you're going to feel the the change of temperature.
Well, that could be bad.
Right. So, and I do sometimes when I want to loosen up the muscle in my back. If I exercise too much, then I let the hot water hit my back and heat it up. But then I take the towel, and as soon as I turn the water off, I throw the towel on top. So
that's really good. And before we go any further,
warm.
People who are listening on Facebook Live, let me tell you, Dr.
See my
Andy
camera going this way.
I'm sorry. I'm learning how to do this.
My camera lady. I'm going to go with the camera.
I love this. This is fantastic.
It is me. I'm still here.
We're on a ship. We're on a cruise ship. This is a WSBR cruise ship, and it's rough weather out there, right?
Like the weatherman. The temperature is really high, and the wind is coming.
It's windy.
And then you see the person walking behind the weatherman.
Right, in a baby
with the
suit.
baby. I'm like, what's going on with that guy?
So this is, of course, Dr. Andy Mencia, who is the founder of the AGI Medical and Dental Centers in Fort Lauderdale and in Boynton Beach. And if you want an appointment this morning, get your immunizations. Call them. Try to make an appointment. If you have to, just walk in. But it's better to make an appointment. You get more time. 954-489-1345. And that's in Fort Lauderdale. Are you open in Boynton Beach today?
Boynton Beach.
Too cold up in Boynton Beach.
No. Well, last week we were open because everybody were closed, and 1-800-Dentist was sending us patients left and right.
Oh, okay.
So dental department was open last week. This week, I think the nutritionist might be the same
great
patient,
nutritionist.
right?
Yeah, we're doing some wonderful. We just had another person now is watching you. Elisa Rojas is bring. What does it say? Bring them on camera. This is great. Okay, this is great. We're on a cruise ship, really.
We got to bring the camera. Yeah, we'll get better. This is our first.
This is our
first take.
Facebook Live.
And the fact that the fact you're sending us feedback, I mean that we are doing it right.
Yeah,
so that's good. Thank you.
Yeah, we're getting it. So that's good. Well, there are a lot of listeners, and a lot of them, I guess, aren't going to say anything. But
the Fort Lauderdale office, it is open. Okay. The dental department and the medical department both are open. And I don't know if we have any consultant today.
We have Dr. Swabek, orthopedist.
The orthopedic doctor. Now, the spine specialist, orthopedic physician, is working on a Saturday. How rare is for you to have a medical practice that you're going to have a orthopedic doctor, a gynecologist, a neurologist, a podiatrist, a dermatologist, a nutritionist working on Saturday. Oh, including your geriatrician.
Yeah, of course, right.
Your geriatrician. Hey, don't forget me. I mean, working on Saturday. So, that's one of the things we have strived to have the office open. So for those people that have to work Monday through Friday, and they don't want to take time off from work to have to go and see their gynecologist, or if you have to see an orthopedic doctor.
Or your dentist.
Or your dentist. You can go through work, do everything you're doing, and, sometimes you have to go and do an implant. And if you take off from work, say, I have to go to the dentist. Why are you going so often to the dentist? You don't want to talk to people about what you're doing. So you take your during your time off and get your work done, and people at work don't have to, first of all, you won't look bad at work because you're not taking time off. And it's good to have a practice to go to a person that knows you when you get sick on Saturday versus going to an urgent care or a walk-in clinic or an emergency room to waste their time for something that is simple and fixable.
Well, but the other thing, more important than any of this, I think, is the home visits now. When it's too cold outside, they can't come to you.
I was interviewing this other geriatrician that I was talking to her. And, she was saying one of the things that tied her down is her brother-in-law is homebound. And she has an elderly mother, and she has not her brother-in-law, her brother is homebound. And I was talking to her. I said, listen, we do home visit. We understand what that is, to live like that. So there are many, many patients out there that are homebound that society have not put the importance that homebound patient deserve. And yesterday we have a great meeting with one of my providers that do the home visit, and I was praising him, how grateful I am, for him to devote all of his time to do the home visit. Because it's part of my dream in AGI to be able to cover the whole spectrum. So I was telling him, because he used to do hospice, I was telling him, I loved even when my patient going to hospice because they are terminal and they are dying, we never sign off. We never say, okay, now you're going to go into hospice. The hospice doctor will say, we stay on the case. And all hospice company, they know if it's Dr. Mencia patient, don't sign him off. Because a lot of right. Hospice company take it for granted. We have fight with them and say, why you take me off the case? This is my patient.
Oh, see, that's it, because they have their own medical director. Oh.
Right. Which is okay. I mean, I tell them, it's okay for you to do the hospice care, but I'm not turning my back on my patient.
Good for you.
And now they know. Now they know better. They don't sign us off. So, home visits is extremely important. And, people get abused with home visit. And they don't get the care they deserve. So I think it's very important that we follow up those patients, and our nurse practitioner, they go, if you need an ear lavage, they will do it during the home visit. If you need a vitamin B12 shot, that becomes so important to give you energy and to help you to prevent Alzheimer's, we do the monthly B12 shots. If you are getting sick and you need an antibiotic injection intramuscular, we will do that there to prevent you from having to go to the hospital to get treatment.
Let me give that phone number again to make this appointment. It's 954-489-1345. I'm going to get a little stand. I just want to test this. We're going to get something and I'll take care of this.
We get better.
Or I can get like a miner's cap. Let's put it on the front of my head. Okay. 954-489-1345. And I don't want to forget Stonewater Med Spa. So Dr.
The Med Spa is doing so well with Christian as the head of the Med Spa, and as a manager there, he's doing a great job.
And you can come to the Boomer Expo and see them. I think he's probably going to give free massages. He always does that.
Yes.
So come to the Boomer Expo and look for the Med Spa, the Stonewater Med Spa. It's because it's a med spa. It's not just a spa. That's the difference, right?
Yeah, right, exactly. It's a med spa, so you can get your beautification of from the esthetician as well as the physician or PA or nurse practitioner. So we expand the spa. And Stonewater had been there for 27 years. It's not a new business.
But it didn't look like it did then. You have really made it into a...
Me and Ina, my manager,
right.
is the interior designer. She put her touch into everything. And Claudia also with I think between, Christian and Claudia and Ina, they had done a great job. So when I go there, I just go there to get service. I don't go there to get...
just be quiet, everybody.
No headaches,
fix
no
me
drama.
Up. Just fix me up. But let's get back to, we only have a very short time, so let's get back to people
I just forget about Richard back there.
Well, he already got on. He said he was watching you too, so we already got him on also.
Oh, yeah.
But we will be doing this every week now. We're going to get you on Facebook Live like this.
Okay.
And we'll figure it out. And it's very exciting, so you want to tell everybody to get on.
I mean, I cannot come on my pajama anymore.
You never do. That's the beauty of you, always this gorgeous. Now I don't have to describe the way you look. They're going to be able to see you right now. This is a whole new thing. So, Dr. Mencia, this is the new year. And we are very excited that...
And we are trying new things.
That's right. We are trying new things. But the most important thing, actually, is what you mean to your patients. And I have to say that anybody who goes to you, the raves. I never hear people rave about their doctors. You know, they'll say, oh, well, I have the best doctor, but, oh, Dr. Mencia, he is so wonderful. He's this and that. And by the way, you can pick up your Boomer Times there anytime you want to go, right?
And
the new one's coming.
When the patient comes as a new patient, they don't have to take it, but we always offer them a free dental consult.
I didn't know that.
Every new
That's
patient.
something new.
Yeah. So we owe you one then.
Yeah, oh, that's really great. A free dental consult.
All new
Okay,
patients,
everybody.
we offer them. So, because we know that how difficult it is in this country to get health insurance. So imagine trying to get dental. We try to put dental, in the back burner. So if we get health insurance, we are happy. We can get ourselves taken care of if we get sick. But we don't get dental insurance. So
now you have
we
to
offer
wave.
them.
So now you have to wave goodbye, everybody, on your live
Oh,
Facebook. Say goodbye, Dr. Mencia.
Goodbye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.